Yeah, very good afternoon. I'm good. Tell me, how are you?
Yes, sir. I'm also fine, sir. And what about you, sir?
Yeah, I'm doing good. I'm doing good.
Okay, so sir, as a first time meeting, so first of all, introduce yourself, sir.
Yes, sure. My name is Sourendra Verma, and I am from district Gaya, Bihar. And as per my qualification, I have done in journalism and mass communication.
Yes.
I used I used to work in Delhi, but recently I have shifted to my village, and I'm teaching the students to communicate in English. This is all
Okay.
about me.
Okay, sir. So it's may I introduce myself, sir?
Yeah, sure.
Thank you giving me this opportunity to introduce myself. I am Mukesh Kumar Paswan from Nepal. If you talk about my education, I have done CME from Chinnamasta Institute of Technology, Rajviraj, Saptari, Nepal. I have done also graduate from Tirupati University, KTM, Nepal. If you talk about my working, I'm working in health post. I am a health person. I have a government job. And if you talk about my hobby, searching on new things, make a new friends. And my strength is communication skill, and I have YouTube channel. YouTube channel name is English with Mukesh, where I uploaded conversation video, solo video. So that's all about me.
It was a wonderful introduction. So, how long have you been learning English?
Sir, it's talk about my journey. So I have been learning from 1 year, sir.
Okay. So, your YouTube channel is around 1 year old.
Yeah, I learning started English language, and along with a YouTube channel also created. Yes,
Okay.
because my purpose was I am learning this language. So what we have to do? We have to make a new everyday video, and it's
Hmm.
to help me. Yes, one YouTube channel also growing on, and I can also improve my language on myself. So that's why learning started, and YouTube created also, sir.
Okay, okay. That's very very great. YouTube is also providing a very good platform where we can connect to each other and learn and enhance our communication skill and English skills. I have been watching
Yes,
a lot of people are doing this, so you are doing great work. And tell
thank you, thanks,
something
sir.
more about yourself.
Sorry.
Tell me something more. What kind of work do you do?
If talk about my work, so I work in hospital, where
Okay,
this is the community hospital.
okay.
There are many patients come who has
Mhm.
fever, diarrhea, dysentery, and like as caught injury and pregnant
Mhm.
women. So which the
Mhm.
government supply medicine. So that kinds of medicine I supply, and I also started immunization program every
Okay.
month, and many
Mhm.
children come, and they what is the government provided vaccine, so I
Mhm.
give to the children. So that kinds of work I am doing, my work station, community hospital. So that's all
Okay.
about my hospital, sir. About
Okay, that's great. So, where is your community hospital?
in ward level, sir, ward level in Nepal.
Okay, oh, okay, great, great. So, all the facilities is being provided by Nepali government.
Yes, yes, all provide Nepal government in the community level, which is
Mm-hmm.
the basic needs, basic treatment in ward level.
Mm-hmm.
So everything provided to the
Okay,
people, public.
okay, okay. And where do people go for higher treatment if they suffer from a major disease like cancer or anything? Do they go to Kathmandu or out of Nepal?
Out of Nepal, also many places: Dharan, Kathmandu,
Mm-hmm. Mm-hmm.
Chitwan. Biratnagar.
Mm-hmm.
There are many places, big hospital.
Mm-hmm.
There
Yes.
is like as institution and private hospital, government hospital also. So
Mm-hmm.
what kind of patient and which is need? So government hospital refer to better center, which is
Mm-hmm.
the higher center. So that time
Mm-hmm.
refer and patient go and take up treatment, sir. Everything
Okay.
is available.
Everything is available. Okay, okay. So, what do you think?
Yes.
Where is the more facilities and better facilities for patient in a private hospitals or a government-based hospital? Where is the treatment easy and cheap, and I can say free of cost? As we know that
Yes,
in
sir.
private hospitals, the treatment is very costly. If we go to any private hospitals, the treatment is very costly. The charges, the operation charges, and all kind of diagnosis charges, these are very costly, and people have to pay when they go to a private hospitals because they simply don't believe more on government hospitals. They think private hospitals are providing good treatment, so I should go to the private hospitals. What do you think?
Yeah, you said already right. Yes, I agree with your point. Government hospital and private hospital. Private hospital give good quality treatment. Yes, but they charge a
Hmm.
lot of. Yes,
Hmm.
and
Hmm.
government hospital also provide good quality, but
Hmm.
sometimes not appropriate treatment in government hospital. So that's why
Hmm.
uh, public compelled to the private hospital go.
Hmm.
Yes,
Hmm.
so every country has a problem. That kinds of problem. If facility is available but not working good way, so it is
Hmm.
not good.
Hmm. Hmm.
Governmental sector, yes, sir.
Hmm.
And every facility government have, even then there
Hmm.
are no active. But
Hmm.
private have for hospital is some equipment, but active. That is the different. I
Hmm.
wouldn't say government hospital is not good, private hospital only
Hmm.
good. Both are good,
Hmm.
but where is
Hmm.
lackness little bit. Yes,
Hmm. And there is more rush in government hospitals. When we visit any government hospital, there are a lot of people, and you have to wait for your queue. You have to wait for if you want to meet any doctor, you have to take permission, and you have to wait for some times. And in a big
yes,
hospitals in
yes,
India and in Bihar, if I can talk about Bihar, in like
yes,
Bihar, there
yes,
is AIMS, there is PMCH, and there are many medical colleges and hospital available in Bihar also. But people
yes.
prefer to go to private hospital because in government hospitals there is a lot of people go there, and there is a lot of gathering, and those
Crowded. Yes,
the people, those who have money, they think it's not good to go to the government hospitals because there is a lot of rush, and the staffs, they will not take care of my health properly, so they prefer to pay money and they visit private hospitals. This is
yes,
also
yes.
one of the reason.
Same reason in Nepal country also. Same.
Hmm.
If you would like to good quality, so you have to go private hospital and you have to pay a lot of money. Yes,
Hmm.
and government
Hmm.
private hospital also charged, but less charge. Some charge free. Some
Hmm.
treatment have free of cost. Government has provided. Yes, which
Hmm.
government has provided free of cost. So that kinds of facilities not available in private hospital. That is the
Right, right.
difference.
Yes, yes. And government is also providing like there is a mm, health insurance called Ayushman Bharat
Sorry.
in India. So if you have the card of Ayushman Bharat card, so you are free for treatment of up to 2 lakhs. 2 lakhs of
Okay.
your treatment will be done in any private hospitals, those who are also providing, and the money
Yes.
will
Yes.
be paid from the card. If you have the card, Ayushman Bharat card, so that money, your treatment cost will be paid by the government. So now the people are also availing this type of facilities.
Yes, yes, yes. In my country also that kinds of facilities available. 3 lakh maybe. Yeah, 3 lakh. Actually, I don't know. I don't say that is 3 lakh, 2 lakh. But
Mhm.
insurance, health insurance is provided. 3 lakh
Mhm.
maybe. Yes,
Okay.
provided you have to, if you would like to treatment in government sector, so you have to
Mm-hmm.
pay only 10%, 90%
Mm-hmm.
you free of cost. And if you
Okay.
go to private sector, so that side you
Mm-hmm.
have to pay 20% and 90%
Okay.
you free. So that is the
Okay.
difference. Same like as
Okay.
in health insurance provided Nepal also
Okay.
government. So
Okay. So that type of facilities are being provided by the government.
yes, yes, health insurance card. If you have health insurance, you can get off like as expense free of cost and little charge you have to pay. So it is the good who is poor who have no money, so they can get treatment easily. They have to
Mm-hmm.
like as help. So it is good. Every government has provided that kinds of facility. So it is good,
Mm-hmm.
in my opinion. Also, yes, sir.
Yes, yes. This is very good for the people because there are limited number of government hospitals available in the society, and when the same facility is being provided by the private hospitals, and they take money from your card from the health insurance, so this is good for the people, and
Yes,
especially for the elderly people, people from uh, what more than 60 years of age, they are being provided this type of facilities free of cost by the government
yes, yes,
nowadays.
yes. Sometime in Nepal also, who has elder at least above
Mhm.
60 years, 70 years, so
Mhm.
provided to government hospital free of cost
Mhm.
service to the elder
Mhm.
person
Mhm.
people.
Mhm. This
Okay,
facility
sir.
was
I would like
first.
to ask
eh,
two questions, sir. This is the
yes,
government hospital and private hospital. Yes.
yes.
Private hospital means just I have to understand it is expensive. Government
Mhm.
hospital, it means that is the free of cost. It is cheapest.
Mhm.
So government have also qualified doctor. Everything.
Right, right.
Yes. But there is what where is lackness. So
Mhm.
I would like to say which things is better they have to give quality, and what they have to suggest to the government hospital. What will we
Mhm.
do? So that is the better to the public who is poor. So what kinds of provided service to be regulate? What's your opinion?
Mhm. See, most of the doctors, those who are working in government hospitals, they also run their private clinic and private hospitals. They go to government hospital for 1 hour or 2 hour. After that, for 20 hours or 22 hours, they work in their own hospitals. The main
Yes.
reason is that, and at the as I have already told you, there is a crowd in government hospitals because the poor
Yes.
people, they most of the poor people go to the government hospitals. They think that the facilities are available and the facilities are free of cost. When other people go, they see a lot of rush in the government hospital. There is no bed, there is no proper bed. What I'm trying to say that when if there are 100 patients admitted in the hospitals, and when there are
Yes.
more than 200 patients, if there is a capacity of the hospital is 100 bed and the patients are more than 100, then you have to suffer, the
100.
patient have to suffer, right? The people think, why should I suffer? If I have money, I can go to any private hospitals, and the
Yes.
private hospitals will provide all facilities, good bed, AC rooms, all
Yes.
facilities for attendant also,
Yes.
everything, all diagnosis is available. You don't have to go here and there for diagnosis. You are medicines is available, nurses and compounders are available 24 hours. But at
Yes.
the other hand, in the government hospitals, the doctor will come at one time, he will check up the patient and he will go. and the other another doctor will come after 12 hours or 13 hours. In the between, in the meantime, if the patient condition is not good, there is no one to take care of you. This is the reality of the government hospitals. But the poor people, they go, they suffer because they don't have much money. On the other hand, the people, those who belong to middle class family, they don't have much money, even though they prefer to go to private hospitals because they think that such type of situations is available in government hospital, as per my
Yes.
opinion.
Yes, I agree. I agree with your opinion, sir. Because same, many person at this no wait, no go to crowded. Just I have to pay a lot of money and expensive. That is not matter. How I can take treatment fastly. That is the main thought.
Right, right.
Every person, and
Hmm.
who is poor, who have no money, so that kinds of people have to compel to the government hospital, and they wait,
Hmm.
they crowded, everything they have to facing many kinds of
Hmm.
problem. So
Hmm.
what we have to the government provided to the increasing manpower in government sector and give appropriate
The
treatment in
government, yeah,
time.
the government should
Yes,
make more and more hospitals. The government should build up
yes,
hospitals in every community, like on village level, on block level, and all subdivision level. They should make big hospitals. Like in European
yes,
countries, there is a very much health sector. Health sector facilities is very good in European countries, in Australian countries, and they never go to any private hospitals because all facilities are available in the government hospitals. But in our countries, in Asian countries, we can see
yes,
that only one hospital is available in one district, and the population of one district is more than 10 lakhs, 20 lakhs,
10
30
lakh,
lakhs.
20 lakh,
And
yes,
10
how to
lakhs,
survive,
10,
yes.
for 10 lakhs there is only one government hospital. So there is a much crowd, there is a no facilities, all type of problems are there.
Same problem in my country also. In one district, one hospital, there are more than 10 lakh, 15 lakh people. So they all person goes to one government hospital, and so that's why crowded and manpower lack of manpower every hospital. And if any machines, so one machine and how many patient, a lot of patients, so how to check to one machine. So you have to many
Mm-hmm.
kinds of work to have to develop, many kinds of
Mm-hmm.
machine added, manpower added, everything, building construction, everything they have to improve. Only most of people take easily
Mm-hmm.
way treatment. Yes,
Mm-hmm.
but it is the weakness. It is the weakness of government sector.
Right, right. The government should do because people are paying a lot of taxes. Since morning to evening, we pay a lot of tax, and for that for from that tax, it's the responsibility of the government to bring a more facility to the people, to bring more health facilities and all type of facilities. Not only, I'm not talking about only health sector. The
Yes,
condition of education sector is also not very good. Our children go to the private schools. We used to study in government schools because in our time there were no private schools, there were no good private schools. But my children, they go to private schools because I
yes,
understand what is the condition of government schools in our society, in our area.
same.
Recently, the chief minister of when Arvind Kejriwal was the chief minister of New Delhi, he had introduced many good things. One of his initiative was Muhalla Clinic,
Yes,
and that was very good initiative. In every muhalla, in every locality, he started a community center, and one MBBS doctor was deployed there, one nurse was deployed there, one
yes.
compounder was deployed there, and that